People who have weakened immune systems may not have received full protection after 2 doses of the COVID-19 vaccines if their bodies did not produce enough antibodies. This could leave them vulnerable, especially as more contagious variants circulate. Federal health authorities announced in mid-August that they would allow immunocompromised people to get special additional doses of the Moderna and Pfizer vaccines. Coming up on At the Forefront Live, our experts, Dr. Michael Charlton, Dr. Anand Patel, and Dr. Jennifer Pisano, discuss who this guidance applies to, why third doses might be necessary, and what people can do to effectively prevent contracting and spreading COVID-19. And they'll take your questions live. That's coming up right now on At the Forefront Live. And we want to remind our viewers that today's discussion is not designed to take the place of a visit with your physician. Let's start off today with having each of you introduce yourselves and telling us a little bit about what you do here at UChicago Medicine. And Dr. Pisano, you're actually on set with me, so we'll start with you.
Sounds good. My name is Dr. Jennifer Pisano. I am a transplant infectious disease physician here at the University of Chicago.
And Dr. Patel, you're actually joining us from the back studio as we try to spread people around and social distance ourselves. So let's go to you next.
Thank you. My name is Anand Patel. I'm one of the hematologist oncologists here at the University of Chicago with a focus on patients with leukemias and other sorts of blood cancers.
Great. And Dr. Charlton will be joining us here in just a few minutes from a different location, and we'll get to him in just a couple of minutes. Let's just start off with the program. We have a ton of viewer questions, and we do want to remind our viewers that we will take your questions live on the air, so type them in the comment section. We'll get to as many as possible. But we have a couple of questions that we're just going to use to set the stage. And Dr. Pisano, I'm going to start with you. And let's talk about this third dose. Some people call it a booster. Some people call it a third dose. What is proper, and what's the difference?
Yeah, so a booster dose of a vaccination really is just for when you've already achieved full immunity to kind of give a little boost to those antibodies that float around in your bloodstream. Now a third dose, and now what we're probably seeing is in real time we're getting a study of a 3-dose vaccination series. A third dose would be just something that's scheduled. So instead you'd give it just as part of the initial series. And it sounds like that's what we are focusing on now for our immunocompromised hosts, that instead of a 2-dose series, we will be recommending a 3-dose series.
There are some folks that are already saying, well, gosh, if you're asking for a third dose, that must mean that the first and second didn't work very well. That's not the case, though.
Well, it's hard to say. So there have been some studies that have come out in various groups of immunocompromised hosts, some smaller, some a little bit larger. But as we talk about people with decreased immunity, it really runs a large spectrum of the strength of immunity, depending on what underlying conditions they've had,
Sure.
what medications they've been on. So we have seen in the studies some people not mount a response at all after the 2 doses, and some mount a pretty good response, and then all areas in the middle. So this is really just giving everyone who will mount an immune response kind of the best chance to get that full immunity.
Interesting. So, Dr. Patel, I want to bring you into the conversation. You deal specifically with patients who are suffering from cancer. I have various types of cancer, and those are folks oftentimes that are also referred to as immunocompromised. What do you see with the patients you work with, and what are some things that they need to be aware of?
Yeah, so it really depends on what the underlying cancer is that our patient has. So, for example, when talking about patients with solid tumors, so what we think of as being breast cancer, lung cancer, colon cancer, what we found is that they are generating antibodies and maintaining those antibodies in ways that are much more similar to our patient population that doesn't have cancer. When thinking about patients with blood cancer, so that would be including patients with leukemia, lymphoma, multiple myeloma, what we found is that there are significant rates of patients that don't mount the same sort of antibody response we would expect. For example, the Leukemia Lymphoma Society studied a wide variety of patients, and about 25% of patients with a blood cancer did not mount an antibody response to the 2-dose series. And it varies a lot based on which specific blood cancer you have. So there's a lot of variability, but on the whole, I would say it is a patient population that's at risk, and certainly a third dose will help to minimize some of that risk.
So we do have some viewer questions, and we've had several that were actually sent to us even before the program over the past few days, seeing the ad for the program, and we've had some today. So I do really want to get to as many as we possibly can. And Dr. Patel, this one may be for you. This is from Kat, and it's should a person out of chemo start with an antibody test? Should they get a booster? If they do have a low antibody test, also should they get a booster? What are your thoughts on that?
That's a great question. Thank you so much, Kat, for sending that in. And the way that the FDA has and the CDC has given us guidance on a third dose is patients that are either actively undergoing chemotherapy or still immunocompromised. So really, the effects of chemotherapy can last for a long time. A great example is many of the drugs that we use target specifically B cells, which are part of our immune system. And what's been shown is that even up to 9 months after receiving a therapy directed at B cells, patients are still at risk of not generating an antibody response to those first 2 doses. So I would say it's definitely worth a conversation with your physician, and it may depend on which specific chemotherapy treatments you've received. But on the whole, just because you've finished a course of chemotherapy doesn't mean your immune system is kind of back up to what we would call immunocompetency. You still may be immunocompromised, and you still may be appropriate for a third dose of vaccination.
Dr. Pisano, we've heard a lot about variants. We hear about COVID and then variants of COVID, Delta, et cetera. What are variants? Is that when the virus mutates? What is that exactly?
Yeah, so it is when the virus mutates, and we have seen now, in the United States, it's no news to anybody that the Delta variant is highly predominant. And right now, vaccine efficacy across the board has decreased with the Delta variant, which I think makes it even more important right now that we are able to kind of boost people's immune systems as much as possible to be able to prevent infection and transmission.
Great. Question from a viewer for you. Kathy asks, would this apply to people who received the Johnson & Johnson vaccine? And I'm assuming they mean the second dose in this case, or
yeah. Yeah, so we think that it will apply to people who've received the Johnson & Johnson vaccine. I believe they've been looking at their data and submitting it to the FDA, but I think we're still waiting for more information about what that means, if they should be getting another Johnson & Johnson vaccine. They're also looking at studies of giving a Johnson & Johnson vaccine and then one of the mRNA vaccines. So I think it will mean that another dose is needed, but we're still waiting for guidance.
Dr. Patel, this is a question from Alma, and she asks, should a person cancer-free since 2014 look into a third dose?
That's a great question. And, congrats on being cancer-free since 2014. I would say, again, some of the therapies that we give can stick around for a long time. For example, we think of patients that have undergone stem cell transplants or stem cell therapy as being immunocompromised for an extended period of time. Thankfully, the FDA has given us some guidance on this, and they've mentioned that within 2 years of something like a transplant would be the window that we would still think of someone as being immunocompromised, even if they're cancer-free. Given that it's been several years, it may be that your immune system has regained immunocompetency, and we kind of, based on the guidance that the FDA has given us, if there's no other medicines that you're taking that would classify you as immunocompromised, a third dose may not apply to you as kind of falling under what we think of as being immunocompromised based on the guidance the FDA and CDC has given us.
Dr. Pisano, this one's from Karen, and Karen asks, or says, the statement is, I had the vaccine, have no antibodies from the vaccine due to the fact that I'm on an immunosuppressant, and I got COVID. Would a booster be effective for me?
Yeah, so we hope it would be. I think it's really hard to know because it sounds like you did have an antibody test, although we really don't know what those antibody tests mean when we get that number back. If it's really, really high or if it's really, really low, it might mean something, but it's hard to tell kind of in that middle gray area. So if you've had COVID, you might have gotten antibodies from COVID, and this booster vaccine could be boost those antibodies even further. But again, it would just depend on what your underlying condition was and what ongoing immune therapy you're receiving.
Interesting. Some more questions from viewers. We've got a ton today, so these are great questions so far. Just keep them coming, and we'll knock out as many of these as we possibly can. Margaret says, I have Crohn's disease and was COVID positive in April of 2020. I've tested for COVID antibodies at 9 and 16 months post-infection. I still carry antibodies. Do I need one vaccine or both?
I would say you should get both. Just after natural infection with COVID-19, it's hard to know what kind of antibody response you are going to get, even if you're not immune compromised. So, there's varying levels of infection. Some people are asymptomatic, some people end up in the hospital, and we are recommending that across the board for immune compromised and immune competent folks, that they all get 2 doses of the vaccine, even if they've had natural infection. And you just need to wait until you're not spreading the virus anymore to be able to go start that vaccine series.
And Bob has a good question, wants to know if this would apply to caretakers as well.
Oh, absolutely. I think that it's so important that, if you are living in the same household of somebody who has a decreased immune system and you're unsure of what their vaccine response will be even after a 3rd dose of the vaccine, that anyone who's going to be a close contact, including caretakers, get vaccinated. That's probably one of the most important points we can make today.
Leah wants to know, what about stem cell transplant patients? And maybe Dr. Patel, that would be one for you?
Yeah, absolutely. So the FDA has given us guidance that patients that are within 2 years of receiving a stem cell transplant would still be considered immunocompromised. And there may be situations where even beyond that, we would consider patients that have been a recipient of a stem cell transplant immunocompromised, especially because many times these patients are on medicines to suppress the immune system for extended periods of times, whether that be steroids or other medications. The timing of receiving that 3rd dose should be discussed with your transplant physician, but we are recommending that our patients that are recipients of stem cell transplants do in fact get their 3rd dose of vaccination.
Here's an interesting question from Barbara, and Dr. Pisano, maybe I'll direct this one at you. Are persons with severe COPD considered to be immunodeficient?
So, right now in general, that group would not fall into the immune deficiency group. However, if they are taking other, systemic steroids, they might fall into that group. So really, I would talk to your physician to see if you would qualify.
What about folks with high blood pressure?
No, not at this time.
Okay, we had another one there. That was so great questions. This is from Barbara. Does it look like there will be boosters from now on? Is this something we're just going to see? This is a new normal for us, I suppose?
Yeah, I think it's hard to say. Okay. And again, it goes back to the first question we talked about. Is this a booster or a 3rd dose of a vaccine? Yeah. So, we're kind of seeing that as things evolve with the number of vaccines people need. I think, we might be seeing the start of a 3-dose series. However, in the future, depending on what variants come, depending on what the numbers are doing, we might all need boosters in the future. So again, I think it's too soon to tell, but I would expect to see a 3rd dose for many of us, hopefully shortly.
It's Dr. Weber getting his shots. So we want to encourage people to, if you haven't had the vaccine already, please go get it. It is safe. There's pictures of our video of our physicians doing exactly that, so it is safe. And I apologize for saying booster. I keep saying booster, and I mean to say 3rd dose. It's kind of ingrained, I think, to call a follow-up a booster, but it's not necessarily that. Dr. Patel, can you talk to us a little bit about kind of what you're seeing with the cancer patients that you work with? Are you seeing a spike in COVID? Is this an issue for the patients, and how do you deal with it if that is the case?
Yeah, that's a great question. So specifically, I focus on patients with leukemia and other blood cancers and take care of them both in the clinic and in the hospital. And we certainly are seeing more patients being hospitalized with symptoms related to COVID. And really, what we've tried to emphasize to those patients, in addition to doing all of the things that are necessary medically to stabilize them and again, get them to a point where they can be discharged, is really emphasize the importance of getting vaccinated if they have not yet been vaccinated, or discussing a vaccination with family members as well. So for many of these patients, they've had an unvaccinated close contact, whether that be a family member or otherwise. And again, this conversation that we've been having for the last several minutes really focuses on immunocompromised patients who, even after being vaccinated, may not have the same sort of protection against COVID that our immunocompetent patients have. So really using these situations as an opportunity to discuss vaccinations, address any concerns that may be around the COVID vaccination with family members has been something that we've tried to incorporate kind of in our routine care of our patients, whether in the hospital or out of the hospital, whether they've tested positive for COVID or here for a routine visit.
Now, we've had multiple questions, Dr. Pisano, along the same line, so I'm going to try to bundle these all up in one. And the question is timing of shot 2 versus shot 3, or even versus shot 1. Some folks say 8 months since after shot 1. Some folks say 8 months after shot 2. And then that is a question by Rosemary right here too. So if you could shed some light on that.
Yeah, no, thank you, Rosemary. I think it's hard right now to know, and actually I would need to go back and look, and you could fact check me on the CDC website if it's from the first or the second dose. I will say that, in other parts of the world, they're doing their vaccines as early as 5 months.
Wow.
So, it might end up just being after the first shot or after you've completed the series. Mm-hmm. Honestly, the way I've been thinking about it to this day is after you've completed the series. But again, you need to fact check me on the website.
So how would that work though? If you are an immunocompromised patient, will you be notified? Is that something you should maybe call your physician's office about? How do you even know when that's going to happen for you and be available for you?
Yeah, so I know that we as a group here at the University of Chicago did make an effort to kind of reach out to our patients, and I know many of the individual clinics who routinely take care of immunocompromised hosts also reached out to kind of let them know that they would qualify. However, I would encourage you, because sometimes those communication channels get mixed. Mm-hmm. If you do believe that you're immunocompromised and you fall into this group, I would encourage you to reach out to your physician and have that discussion. Never
hurts just to make a phone call if you're in doubt.
Absolutely.
This is from Jean, and this is an interesting one because we're talking about the flu vaccine. This is that time of year again. Any information on timing the third dose and getting the flu vaccine, because there was some talk about 14 days apart at one point. Are we still looking at that? What should people be aware of there?
Yeah, so we're still giving a lot of vaccines, during the first time when COVID here started, as well as in the spring. But since then, the CDC has kind of walked that back a little bit.
Interesting.
So right now there is no limitation on separating the two vaccines. So that should not be a concern, but this fall, you should be getting both the COVID-19 booster if you qualify, as well as your influenza vaccine.
Dr. Patel, this one's from Marion, and Marion is wanting to know if she should get the booster. She had COVID in March of 2020, was hospitalized for 2.5 months, so that's pretty significant, and she is also a breast cancer survivor, but just recently had a reoccurrence and had to have radiation, so she is wondering what to do.
Yeah, so I would say, first of all, if she has not started the vaccination series, definitely going ahead and getting the routine kind of 2-dose vaccination. We don't think of radiation as being maybe immunosuppressive in the same way as, say, chemotherapy. But if chemotherapy is going to be part of the treatment regimen moving forward, completing the 2 doses and then getting the 3rd dose when appropriate, and I believe the FDA has told us it should be 28 days at least after dose number 2 before you can get dose number 3. Going ahead and getting dose number 3 as well if she'll be receiving chemotherapy as part of the regimen to treat this recurrence of breast cancer.
Great. This is one from Lorena. I don't believe I've asked this already, and it's just kind of a basic question, but it's important, I think. And she asks, does the COVID-19 vaccine eliminate the possibility of the vaccinated person spreading the virus to other people?
Oh, Lorena, thank you so much for asking that, because it is a really important question. We thought, with earlier variants, we talked about the variants having mutations, earlier in the pandemic, that the vaccine did prevent transmission. However, especially now with the Delta variant, we've seen that people carry higher numbers of virus with them, and they are still able to transmit even if they've been vaccinated. So kind of another take-home point, I think, for this discussion is that it does not, you should still be masking, even if your immune system is low and you've gotten all 3 shots, it doesn't take the place of masking and social distancing and hand hygiene and all of those, behavioral strategies we do to decrease transmission, as well as keep an eye on your community numbers.
I think it's just such an important reminder because particularly for folks who are immunocompromised, and people don't think about this a lot of times. You hear people say, well, I don't need to wear a mask, I've been vaccinated, I'm fine. You don't realize what that person next to you is 100%. Potentially going through or facing from they may have a condition, they may be immunocompromised, and you're protecting them. You're actually providing a courtesy to that other person, and it's just the nice thing to do.
Absolutely.
So this is from Barbara. I've had a post-vaccine autoimmune phenomenon and contract transverse myelitis 10 years ago. Should I be worried about taking the Pfizer vaccine? I want to be protected, but I'm worried it will trigger an autoimmune response.
Yeah, so this came up a lot, I think, in the winter. And right now, it is a discussion you could have with your provider. Right now, we're saying it's not a contraindication. And they have looked at evidence. They have looked at incidents of Guillain-Barré and other post-vaccine phenomenon. So right now, I would say it's not a contraindication, but please talk to your provider.
Exactly. So Mary asks, can I switch brands now? I got the J&J in February. Could I get Moderna or Pfizer now?
Yeah, so again, this is, it is not approved yet for, a booster shot or a second dose after the Johnson & Johnson
Sorry,
vaccine.
I think I did that to you.
No, it gets confusing, certainly. But there are some studies going on about, kind of mixing and matching vaccine series, and there may be a benefit to getting a Moderna or an mRNA vaccine after a Johnson & Johnson vaccine. There may not, but maybe there is some limited data that shows that it could be beneficial. So I think we have to wait and see, but I am hopeful.
Could you just briefly explain in very, very much in layman's terms the difference between the mRNA vaccines versus a Johnson & Johnson vaccine? Because there is a little bit of a difference there.
Yeah, so the mRNA vaccine uses the protein code to be able to be translated in the cell to make the spike proteins. So then that your body can react against the actual spike protein of the virus and make those, and then those are antibodies that you keep with you. With the Johnson & Johnson vaccine, it's just one step before, so it uses a DNA code that gets translated into RNA and then made. So there is a little bit of a subtle difference there.
Interesting. So Jennifer has a question, and I've never thought of this one before, so this is a new one. Sorry. No, this is a good question, I think. She mentions that when she saw people getting vaccinated, everybody gets a pre-measured dose. What about people that are quite a bit larger than other people? Does that make a difference?
Yeah, it might. I think it's hard to know. We don't vary the doses of other vaccines depending on weight or height or other things. But we do that with some medication. So I can honestly say I have not thought of that question, and I do not know right now.
Well,
but it shouldn't.
Yeah, well, part of the reason why I'm interested in that, I saw one of the news reports, I think it was Moderna, was talking about should they do the standard dose for the third dose, or should it be half the size?
Yeah.
And I know there's a lot of discussion around that right now, and I thought that was quite interesting.
Yeah, no, I certainly thought it was interesting too, especially as, we really need to make a strong campaign here in the U.S. to get vaccinated, but we're not safe until the whole rest of the world can get vaccinated too. And in other parts of the world, they're not able to get vaccine as readily as we are. So giving a half dose of Moderna for a booster could actually free up some supply to be able to be given other places.
So this is a person who has a heart condition, and they want to know if that's if they should get it.
I would say please get it when it is approved as a booster. But right now, depending on what kind of heart condition it is, if you are not on any immune suppression for it, then I would say you do not qualify at this time.
And unfortunately, there aren't specifics in here. I'm kind of going back and forth between questions and Ben from our social media team is firing questions at me right now, but yeah, that one doesn't have specifics as to, it says we card, but that's all it says. Interesting. So, so kind of the reminder for folks though is first of all, it's got to be approved. You speak with your physician about the third dose, and particularly, you know, immunocompromised folks will be at the top of that list. What about healthcare professionals? Well, when will you get yours, do you know, or is that still kind of out there?
Well, so I think it's still kind of out there. You know, at the end of August, there was a press conference coming from, you know, the CDC, the White House, Dr. Fauci, saying that they were targeting September 20th. But I think this has come out, you know, a little bit, become a little bit of a controversial date, although, you know, it does kind of fall in line nicely when many of us first got our first doses of vaccine. You know, I got my first dose in December, so my second dose in January. So, you know, I would qualify even now, and I do think of other parts of the country who are currently surging with COVID right now, and how important it will be to get those healthcare workers a third dose so they can, you know, remain protected along with all of their PPE, masks, gowns, gloves, to be able to continue to take care of those patients who come in with COVID.
Dr. Patel, this is a patient who says she was just recently diagnosed with breast cancer. Should she get should she seek out a third dose immediately?
I think it's a conversation that probably needs to happen with her physician, particularly the timing of that third dose, because we know that some chemotherapy drugs may limit someone's ability to kind of mount the same sort of antibody response that we would expect. So discussing the timing of a third dose and what therapy is planned for the breast cancer, I think, will be very important in making that determination about whether that patient would specifically be immunocompromised and when it may be most effective to administer that third dose.
So this is a question from somebody who's on the transplant waiting list for a kidney. If I get my kidney transplant, do I need to get the vaccine?
I would, if you are on the wait list, you should be getting your vaccine now. Yeah. You know, the goal would be to get both doses in at least 2 weeks prior to transplant.
Great. We've got about a minute left in the program, and I apologize to our viewers that for some of the questions I didn't get to, but we tried to do as many as possible over the half hour. Dr. Patel, I'm going to get a last word from each one of you, but I want to start with you. What would you have to say to patients who are fearful, and what would you tell folks?
Yeah, so what I would say is we now have the benefit of having data from millions and millions of individuals that have received vaccination against COVID-19. And what we found is that it's incredibly safe, it's very effective, and now we're trying to figure out strategies for how to make it more effective for our patients that are immunocompromised, such as administering a third dose. If you are the loved one or friends or family that knows someone who's immunocompromised, the most important step that you can take is to get vaccinated if you haven't already, practice social distancing, practice masking, and really commit to trying to kind of build that protective bubble around your loved one or your friend or your family member who may not be able to mount that same response to vaccination.
Great. Dr. Pisano, any closing thoughts?
No, I want to underscore everything that was just said and encourage everyone who has not gotten their primary series, to get your primary series, as you spoke about in the beginning of the program. I think that's really an important thing. And then these, third doses for our immunocompromised friends and family, I think are going to be, hopefully very beneficial. But again, like was said before, it doesn't take the place of masking and social distancing. So just because you've gotten that third dose doesn't mean you shouldn't still be doing all of the things that we've been doing since the beginning of the pandemic to keep ourselves and our loved ones safe.
Perfect. Well, you two are fantastic. Appreciate
both
of you.
Thank you. Thanks for having me.
We are out of time. Special thanks to our physicians, obviously, for being with us today. And a big thank you to those of you who watched and participated in our program. Really great questions. Please remember to check out our Facebook page for our schedule of programs coming up in the future. To make an appointment, go online at uchicagomedicine.org, or you can call 888-824-0200. Thanks again for being with us today, and I hope everyone has a great weekend.